Welcome to our health and safety awareness training on hand washing. Imagine these common scenarios. A food preparer touches raw meat containing E. coli. A daycare employee handles toys that a sick child played with. A painter gets acetone and dissolved isocyanates on his hands while cleaning paintbrushes. Workers face a wide range of hazardous situations every day. Exposure to harmful chemicals and infectious pathogens is a serious concern. A large part of prevention includes understanding and using appropriate hand hygiene and washing techniques. This course will provide all workers with basic information about hand washing. After completing this course, you will be able to identify reasons hand washing is important, recall situations that require hand washing, know techniques for proper hand washing, and recall guidelines for washing your hands when using gloves. Let's see what you think. True or false? Hand washing is only important if you are sick. The eyes, nose, and mouth are pathways through which substances enter the body. People frequently touch these body parts and may transfer germs and chemicals without even realizing it. Germs and chemicals can also get into food and drinks being prepared or consumed. Handshakes and being in contact with frequently touched surfaces are ways that germs and chemicals pass from one person to another. The oil from dirty hands can trap dirt and germs on surfaces. Things touched by people can transfer germs and trace amounts of chemicals. A few examples of these things include doorknobs, stairway handrails, bathroom sinks, subway handholds, money, elevator buttons, tools, and children's toys. Germs and chemicals are easily transferred. Start with a person with unwashed hands. That person prepares food and eats it. He also shakes hands with others and touches surfaces that others touch. Another person touches one of these surfaces and then eventually touches her eyes, nose, or mouth. She has allowed germs to have a point of entry into her body, potentially making her sick. You cannot see tiny germs and the smallest traces of chemicals. That's why it's a good idea to wash your hands anytime you feel that they might be dirty. But you must always wash your hands when performing tasks such as medical care and dental care, food handling, food preparation, and food service. Contact with anything potentially unclean, such as animals or garbage, and use of tobacco products, using restrooms, applying cosmetics and lip balm, eating, drinking, or consuming medications, and inserting or removing contact lenses. Which of the following are situations in which you need to wash your hands before doing anything else? Select all answers that apply. Alcohol-based hand sanitizers can be considered in addition to proper hand washing, and when hand washing is not possible. Use a hand sanitizer with at least 60% alcohol. Apply the sanitizer to the palm of one hand and rub it all over the surfaces of both hands until your hands are dry. Soap and water are needed when hands are visibly soiled or greasy, or when they are contaminated with chemicals or irritants. Know that hand sanitizers do not eliminate all types of germs. For example, norovirus, a major cause of gastroenteritis or stomach flu, is an example of one germ resistant to alcohol-based hand sanitizers. To wash your hands effectively, follow these hand washing procedures. Wet your hands with clean running water and lather them with soap. Point your fingers down so water and contamination won't drip toward your elbows. Be sure to scrub all parts of your hands, including palms, backs, fingers, between your fingers, and under your nails. Keep scrubbing for at least 20 seconds. Friction helps remove dirt and microorganisms. Rinse your hands under clean running water. Select the link to play a video showing someone washing their hands effectively. Drying is critical to reducing recontamination. Wet hands transfer contamination more readily than dry ones. Whenever possible, dry your hands with a single-use towel. Roll-type cloth towels are a source of recontamination. You can use air, but realize that the force of warm air dryers may loft contaminants, and pathogens may be present due to moist air inside these units. Paper towels are a more hygienic way to dry your hands because they can physically remove contaminants with less chance of recontamination. Buttons, levers, and crank towel dispensers are sources of recontamination. Touch-free faucets, soap dispensers, and towel dispensers minimize cross-contamination. The sink, including the faucet controls, may be contaminated. Consider turning on and off the faucet using a dry paper towel. Wash around and under rings, but know that rings and jewelry may be prohibited in some workplaces. You cannot be sure jewelry isn't harboring germs and other contaminants. Protect your hands from touching dirty surfaces as you leave the bathroom. To keep soap dispensers from becoming a breeding place for microorganisms, thoroughly clean the outside of dispensers before refilling. Employers need to determine alternate methods of hand washing if sinks and a public source of clean running water are not available. There are options to bring in clean water and set up hand washing stations. You're preparing dinner, and you handle raw chicken for a few seconds. What is the best way to ensure you don't transfer potential germs to other surfaces? Healthy skin is a barrier to infection, whereas compromised skin is vulnerable, so report any discomfort from hand washing. Gentler soaps may reduce chapping and irritation. Moisturizing lotions may help, but some lotions degrade rubber gloves, so always follow your employer's recommendations. Diligently clean and trim fingernails since they may harbor dirt and germs. As stated earlier, scrub under nails with soap and water whenever you wash your hands. You may be asked to wear gloves because your job requires it. This is commonly the case in healthcare and food service settings and when handling chemicals. Wearing gloves does not replace the need for adequate, effective hand washing. Gloves may have small, undetectable defects. Gloves may be torn during use. Do not wash your gloves as a way to avoid changing them. Wash your hands before putting on gloves, since bacteria can multiply in the warm, moist environment inside of gloves. Wash your hands immediately after removing gloves. If you work in a healthcare setting and use disposable gloves, change your gloves after each patient contact and wash your hands after removing your gloves. When you remove your gloves, you may contaminate your hands. Practice proper removal techniques to minimize touching the outside of a glove with your bare hand. Remember also that gloves can pick up bacteria from dirty surfaces and transfer them to food and others. Gloves need to be changed according to your employer's policies and procedures. Which of the following actions supports good hand health? Select all answers that apply. This course provided you with basic information about hand washing. You should now be able to identify reasons hand washing is important, recall situations that require hand washing, know techniques for proper hand washing, and recall guidelines for washing your hands when using gloves.